In a few months, Sally Johnston will turn 72. And while she protects her skin nowadays, she wasn't so vigilant when she was younger.
My generation, we sat out in the sun with baby oil.
Johnston thought the small dark spot on her face was just an age spot. But when she finally got it checked out 10 years after she first noticed it, the doctor diagnosed her with LENTIGO maligna, or stage 1 melanoma. And although she says she wasn't an obsessive sunbather, Johnston's pale skin puts her at higher risk than others.
The most people who are the most susceptible to developing skin cancer are people with fair skin, blue eyes, and blonde hair, as well as people who have a family history of melanoma or multiple skin cancers.
And Sally's family history is clear of cancer, but Dr. Houghton stresses the importance of protecting the skin regardless of your genetics or your skin tone.
It's important that you wear a broad spectrum sunscreen that's both water resistant and has a sun protection factor greater than or equal to 30 every single day.
That's right, SPF does matter. But it's not just the strength of the suntan lotion that can affect you, it's how much of it you're putting on. Doctors say you should have at least 1 ounce for your whole body. That's the size of a shot glass. They say you should also wear sunglasses and a hat for protection.
And look for signs of any changing moles or spots that look different from the others, and that should encourage you to see your dermatologist.
As for Sally Johnston, her melanoma was removed by excision, a 1-day procedure of quickly cutting the cancer out. But Dr. Houghton warns it could have been much worse.
As skin cancer has time, it will invade deeper into the skin, sometimes going into the bone and the nerve, and that's when patients can have more disfigurement and actually require more complicated procedures.
And by more complicated procedures, she's referring to ones like chemotherapy, which is why, again, she stresses the importance of regularly protecting and examining your skin. Because when it's caught early, and here's the good news, melanoma is actually 98% treatable. In Stony Brook, Itzcovitz, FIOS 1 News.